digestion organs. And then we're just going to talk about what's in the mouth, the esophagus, and it's a lot. I will tell you right now, there's 10, no, I'm sorry, 6, maybe more, I think, cranial nerves that have to do with digestion. It's terrible. It's terrible. You're going to cry a little bit. That's okay. We got this week and next week to talk about it. There's a lot of information. Okay? And I need you to remember everything. When you take that test with me, man, you gotta try your best to put things into perspective. Try to make sure that you understand everything from the mouth, and then the esophagus, and then the stomach, and then the small intestines, the duodenum especially, and then the 3 parts of the intestines, and then the large intestines. There's a lot of segments, and you have to divide them up. And you have to make sure that you can work it so that it's organized. Don't organize yourself with digestion, okay? Please, it's a big subject with a lot of different things going on. It's one of the biggest systems in the body that, I mean, it's digestion, so it's all about nutrition. It's all about getting healthy and eating the right foods, and the way we digest has a lot to do with our health. Remember, urine and feces are a way of determining your health. So remember that. It's all about waste products. How you sweat, how you urinate, how you defecate is all part of your health. And we're going to be talking about digestion, and that's going to be defecation. Okay? So some terms that we're going to use right away. When we're talking about chewing, we talk about a word called mastication. When we talk about swallowing, we talk about degglutination. When we talk about the movement of food in the digestive system, we talk about peristalsis. When we talk about food being absorbed through the intestinal tract, well, that's called absorption. Is there a P there or no?
Yeah.
There is. Absorption. And obviously, when we release our waste, we call it defecation. So mastication is chewing, degglutination is swallowing, peristalsis is movement, absorption is nutrition being absorbed through the walls, and defecation is shitting. No, it's pooping. Poop. You know what I'm saying? Now, we're going to be talking about some cranial nerves. So let me just give you an understanding of cranial nerves, how they work with the digestive system. First of all, the major guide nerve in the digestion system is going to be the vagus nerve. And that's the parasympathetic nervous system. Parasympathetic. Sympathetic nervous system. And that's also called rest and digest. Okay? That's one of them, the major one. Without the vagus nerve, we digest very poorly. And remember, what's the opposite of the vagus nerve? What's the other one? What's the opposite of parasympathetic? The sympathetic. So if this parasympathetic activates your digestion, it makes it move, what the sympathetic would lower it. In other words, you wouldn't get a good movement of food going through it. Defecation would be difficult. You'd have constipation mostly. You would have problems of emptying out your stomach because of the sympathetic nervous system. You understand? You need. That's why they always say people that are nervous, people that are stand up when they eat. You need to relax when you eat. That's why. That way, the rest and digest will take over. You understand? People that have high anxiety, they don't eat. You know that when you take a pill to not, you know those diet pills? Those diet pills that you eat, you know what they do? What are they? They're sympathetic agonists. They cause you not to be hungry by giving you that sympathetic nervous system stimulus. That's what they do. That's what it is. But there are side effects of sympathetics, aren't there? What else does sympathetic do? What does it do to your body besides stop the digestion? Increases heart rate, increases blood pressure. You understand? Dries up the mouth. You understand? It does things that are opposite of what you should be going through when you want to eat. Okay, so that's an understanding, right? So it's so funny when we look at food, our mouth salivates and our gut moves, right? And that's the optic nerve, cranial nerve number 2. So cranial nerve number 2, the optic nerve, can cause our digestion indirectly to activate, can't it? When we see food, don't we get hungry when we look at food? Right? Makes our mouth salivate and our stomach move. Okay? Cranial nerve number 1, the olfactory nerve. Because when we smell food, we salivate and our gut moves. Isn't that true? We get hungry when we smell food. So these are indirect cranial nerves that we're dealing with. When we talk about chewing, cranial nerve number 5, trigeminal. With chewing, that's cranial nerve number 5 for the muscles. It's for seeing. This is for smelling. This is for seeing. Okay, what else? Well, what about our tongue? Doesn't our tongue have to do with digestion? Well, there you go. Cranial nerve number 12, hypoglossal nerve. Hypoglossal nerve. Tongue movement. And this is also helping for swallowing. We swallow with our tongue, don't we? Don't we swallow? We need the tongue. So that's cranial nerve number 12. What? Hypoglossal. Glossal means tongue. Well, what about the taste of food? Don't we need to taste it? Well, there you go. Cranial nerve number 7 and cranial nerve number 9. 7 is the facial nerve. 9 is the glossopharyngeal nerve. Taste. Cranial 9. Glossopharyngeal. And glossopharyngeal by itself. Cranial nerve number 9, glossopharyngeal, is also for swallowing. So by itself, cranial nerve number 9 is for swallowing. Does everybody understand what I just wrote here? This is simplifying it. Okay? We're simplifying it. This is digestion at its best. So we have number 10. 1, 2, 3, 4, 5, 6, 7 cranial nerves that have to do with digestion. Okay? I'm going to be repeating these nerves as we talk about it, okay? Because we're going to start here and work our way down. Is that understood?
Yeah.
You understand what this is, right? Can I erase this?
So